It is my great honor to be invited here, and I have no financial interest in my presentation. I'm going to present meibomian gland dysfunction up to date. Most of the data is supported by TFOS. So this contains definition and introduction of MGD and the diagnostic and the treatment update. As you may know, the MGD is a very good portion of dry eye. And when you compare the volume and the function of meibomian gland, upper eyelid is almost twice of lower eyelid. So when you compare the total volume is upper meibomian gland is 26 and the lower meibomian gland is only 13. So upper eyelid meibomian gland more important things. And there is a lot of change of meibomian gland definition. So MGD is not disease, it is meibomian gland dysfunction. It's a chronic and a diffuse abnormality of meibomian gland, commonly characterized by a terminal duct obstruction and or qualitative quantitative change in granular secretion. So symptom is irritation, and the sign is inflammation of the eye, of the eyelid, and ocular surface disease. And this is classification of the MGD. So this is a low delivery and high delivery. As you imagine, low delivery is a more high portions, and there is obstructions, and there is a two cicatricial and non-cicatricial. This is a classification of MGDs. This is a non-cicatricial MGD, and this is cicatricial MGD. There is a very different mechanism. And in non-cicatricial MGD, there is a hyperkeratinization of terminal duct. And this like this, and then the increase of pressure in duct, and then acini can be dyed. So it is a mechanism of non-cicatricial MGD. But in contrast, in cicatricial MGD, very different pathophysiology. Submucosal conjunction scarring drags meibomian gland orifice. So there's change of the way of secretion of meibomian gland, and this is narrowed, and the displaced duct can no longer deliver effectively of tear film lipid layer. So there is completely different mechanism. And 2017, TFOS due to classification. There is a long sentence of dry eye definition, but among them, tear film instability is included. And in diagnosis, and this is MGD diagnosis tools, and among this, MGD is here, and from the mild to severe, and we can classify. And 2011, the MGD workshop, there is four stages, from the 1 to 4. There is many devices, and one is a distal pressure, and the second is a standardized application of pressure. So with this specific device, we can see the secretion of meibomian gland. And then there is some qualitative and expressibility of meibomian gland. So this is when you check the secretion and from the clear fluid and some turbid and the capping of the meibomian gland and telangiectasia. So with this finding, we can classify the MGD. And in diagnosis, there is two methods. One is surface interferometer. It is a functional analysis of the meibomian gland, and the other is a meibography. It's a structural analysis of the meibomian gland. In functional meibomian gland evaluation, we are using ocular surface interferometer. So there are several kinds of interferometer, like LipiView2 and the DL1 alpha and telescope 2. And one has a qualitative and a quantitative evaluation, but DL1 alpha is just qualifying the evaluation, and the telescope 2 is also quality, check the quality. In LipiView, and we can see some quantitation of the lipid layer thickness, and then there is many papers already show the evidence is how much it is good. And in another ocular surface interferometer designed by Yokoi in Japan, he classified from the grade 1 to grade 4, depending on the color. And in structural diagnosis, there is several micrography like keratography M5 and the LIPIV2. And in my lab, we are developing the 3D micrography. And this is a classification of MGD using micrography. This is originated from Arita Reiko in Japan. And this is ongoing experiment in my lab, and we can see the 3D structure of the H9 volumes. So with this method, we can see the volume and the size of meibomian gland. This is summary, and in many diagnosis tools, and choosing a proper tool is very important to diagnosis and MGD. And depending on the MGD severity, and we can choose some treatment like eyelid hygiene and lubricant and oral tetracycline and anti-inflammatory therapies. This is fundamental treatment strategies: anti-inflammatory agent, nutritional supplement, and lid hygiene. In antibiotics, we are using oral tetracycline and azithromycin, like that. And in nutrition supplement, we are using fatty acid and omega-3. And lid margin height is also very important, so we should remove the Demodex to improve meibomian gland function. And in drugs, some papers shows the cyclosporin has a good effect for the meibomian gland disease treatment. And in another papers, in the diquafosol, it is a P2Y2 agonist. It is also effective in the MGD-related signs. And next, presenters explained some effect of IPL, and this is very several mechanisms. And in several papers, I say IPL is also very effective to reduce the symptom and sign of MGD. And this is lipid flow, is its dermal pulsation is also very effective with MGD. And also in Korea, we are developing some dermal massaging system. It is also very effective to treatment MGD. And in some clinicians are using proving. So without proving and the squeezing is make MGD is worse because orifice is closed, and if we're squeezing and intraductal pressure is increased, and it is harmful to the S9. So some clinicians emphasize to use MGD proving, and there is evidence about that. So summary, and we are using these dry drops, and in the take-home message, meibomian gland is important contributors to the maintenance of the healthy ocular surface. And MGD is a broad film referring any functional abnormality of the meibomian gland, and the proper choice of diagnosis and the treatment tool is very important. Thank you for your attention.